I am aware of the presence of more than 5,000 registered delegates from more than 30 countries, enthusiasm and interest. The activities of CISA through GAF are all geared towards actualizing the true potential of Ayurveda to solve contemporary health challenges. All our ideas and actions have emerged more as a culmination of extensive collaborative process involving some of the greatest minds of medical science and Ayurveda scholars over the past 3 decades. Today, we have one such great medical scientist of our times, Dr. Saumya Saminadhan, to kickstart the scientific proceedings. Dr. Saumya needs no introduction to all of you, but I would like to mention a few words while welcoming her with lots of gratitude and happiness to the GAF platform. Dr. Saumya is the daughter of father of Green Revolution of India, Dr. M.S. Saminadhan, and Indian educationalist Meena Saminadhan. Dr. Saumya received an MBBS First Medical College in Pune and an MD in Pediatrics from AIIMS, New Delhi. Until 2013, she was Director, National Institute of Research in Tuberculosis, NERT, in Chennai, and then Director General of the Indian Council of Medical Research and Secretary of the Department of Health Research of Ministry of Health and Family Welfare for the Government of India. From October 2017 to March 2019, Swaminathan was Deputy Director General of the World Health Organization. In March 2019, Swaminathan became the Chief Scientist of the World Health Organization, where she participated in regular bi-weekly press briefings on the COVID-19 pandemic. Swaminathan's areas of interest are pediatric and adult tuberculosis, epidemiology, and pathogenesis, and the role of nutrition in HIV-associated TB. Following Dr. Swaminathan, we have a great Ayurveda clinician, but now an administrator, who is well known to all of you, Vaidya Manoj Nesari, who is the advisor of the Ministry of Ayush, Government of India. I welcome him to the GAF platform and look forward to his continued patronage and support for all our endeavors. Now, I request Dr. Swaminathan to take over the dais and give her plenary keynote address on the host defense system that has been presented by GAF for the core theme of the conference. Thank you to all of you. Welcome, Dr. Swaminathan.
Thank you so much, Dr. Gangadhar, and namaskar to all the dignitaries that are present at this inaugural of the 4th Global Ayurveda Festival. And it is indeed my honor and pleasure to share a few thoughts with you today. I have been the chief scientist of the World Health Organization now for the past 2 years or so. And it has been a really very challenging and humbling and exciting experience and journey to not only chart a new path, that is the establishment of the science division and the first chief scientist position in WHO. So that in itself has been a huge opportunity. But in addition to that, of course, we had the COVID pandemic in 2020, which is still continuing, and for which the science division played a major role working hand in hand with the emergencies program of WHO, as well as with our technical counterparts, both within the different WHO regional and country offices, but also with our technical counterparts in the ministries of health and public health agencies across the world. And our work has been of such a huge range, from coordinating the epidemiology, the data collection from the countries, analyzing it, making sense of the daily cases and deaths, which has been, of course, varying from region to region, country to country. We have had ups and downs, as all of you are aware. So that itself is a huge exercise. And one of the things that we observed when we do the data collection from countries is that very often we do not get age and sex disaggregated data. And it really highlights the importance of good data collection. And I think it's important for this Global Ayurveda Festival and especially for the scientists, the researchers, the young Ayurveda physicians who are attending this program to understand the importance of data, of collecting good, strong, high quality data, whatever your field of expertise, whatever the field of medicine may be, without a solid um, data set to draw your evidence and your conclusions from, it is very, very difficult to make progress in any field. And so with COVID, we were faced with this challenge that in many countries, there are not enough diagnostic tests available at the beginning. And even today, there's a lack of diagnostic kits available in many low-income countries. And so we have very sketchy and patchy idea of the extent of the disease. We have seen in many countries, including in India, that the zero prevalence studies that were done at the community level to indicate the extent of infection showed that the infection rates in the community were much, much higher, sometimes 10-fold, 25-fold higher, or even more than that, than the reported cases. So while today we say we have 100 and close to 120 million reported cases of COVID-19 and over 2.6 million deaths, these are only the documented and the counted cases, and the real true figures are probably much, much higher. So I wanted to start by making the point about data. The other area, of course, that we've been working on a lot is research and R&D in particular. We convened early in February 2020 the first Global Research and Innovation Forum, bringing together academics, researchers, private and public agencies to identify the knowledge gaps and the research needs. And for COVID-19, of course, there were a lot of knowledge gaps at that point. We did not know much about the virus. It had just been, of course, identified and given a name, the SARS-CoV-2, but we didn't know much about how it behaves and the clinical and its epidemiological manifestations. But we kept on learning very, very fast because the global community of scientists has really risen to the challenge. I would say the amount of work on this virus is probably much, much, many times higher than the amount of research on all of the, previous viruses put together. In 1 year, the amount of information and knowledge about the structure of the virus, how it spreads, the transmission modes, the how it affects the body. We started off by thinking it's a respiratory virus, and we recognized that it was a multi-system. It could affect all body systems, that it has long-lasting effects, the long COVID, which is seen, in up to 10% of survivors and in a much higher proportion of survivors who are hospitalized or in the ICU. They suffer from symptoms which go on for many months. We started understanding the immunology of this virus, and we still are understanding. I would say we don't know everything yet. We know that there is innate immune response, particularly in the respiratory mucosa, that plays an important role in the initial immune response to the virus. And then there is the adaptive immunity, which comes in later, which are the antibodies, the neutralizing antibodies, as well as the T cell responses. So both the cell-mediated and the humoral immune system play an important role. And it's important to understand how the immunology works and what is the protective immunity, because we need that for development of vaccines as well as therapeutics. What we need to identify, and we still don't have, is a correlate of protection. What is that level of antibody? What is that level of the T cell response? And how do you measure that? How do you standardize it so that you can compare different studies of different vaccine candidates and also look at people who have recovered from natural infection to see how long their immunity will persist. So there are still a lot of questions that need to be answered. Though we have learned so much about the virus, we still need to continue the research. And for this, we convened, as I said, large groups of scientists. We have continued to convene throughout the past 14 months on a daily basis. We have meetings with different expert groups who have been progressing. And some of the things that we have done, that WHO did, particularly the R&D blueprint, which is managed by the Science Division and the Emergencies Program jointly, is on the standards for research into, especially into diagnostics, therapeutics, and vaccines. How do you identify the target product profiles? What are the template and core protocols that can be used for clinical trials? What are the prioritization criteria for certain candidates to be advanced into clinical trials? How do you assess and compare the different products? And then finally, how do you proceed for regulatory approval? What are the terms and conditions for an emergency use listing? And as you know, the WHO has already provided emergency use listing for 3 vaccines, and the Johnson & Johnson vaccine will be very soon, I think today or over the next couple of days. But what you need for this is preparatory work. When there is an emergency, when there's a pandemic, you cannot overnight launch a research program if you have not been prepared for it, if the systems are not geared up for it. And this is where, in countries which already had a very well-organized system of research, where they had well-functioning networks of research centers, where they had well-functioning ethics committees, well-functioning central regulatory authority, were able, and of course funding from government or from other agencies, they were able to start and complete some research studies very quickly and in a very high quality manner. And this is why we believe that investing in research capacity, strengthening all of these elements that you need not only the clinicians, you need epidemiologists, you need statisticians, you need nurses, you need social scientists, you need counselors, you need people who will follow up the patients. It's extremely important to adhere to the highest standards of ethics when we are doing research. And the ethics has to be in the context of the local region, country, or even at the state level. It has to be in the language that the people understand. It has to be ensured that people understand they're participating in research, that they have informed consent that they provide, and that all facilities are provided to the participants of research to ensure that there is no undue harm or any concerns about the safety of the participants. And the safety is not only from the point of view of a new drug or a vaccine, it's also from the point of view of the stigma sometimes that's associated with certain diseases and the response that the communities can have. So investing in research preparedness and investing in research is one of the hallmarks, I think, of a developing country and economy that really believes in knowledge generation and believes in ensuring that all of its programs are based actually on science, based on data, based on evidence, and that there is a constant re-examining of the programs and modifying based on improving gathering of knowledge. And then equally important is the communication of that knowledge. We have seen that in the response to the pandemic, the difference between countries that did well and countries that did not do well, one of the factors was the trust that people had in the messages that were being conveyed, and the openness and transparency and frequency of communication. And it's not only a question of providing information, it's also a question of listening to people's questions, trying to answer them, and being able to allay their fears, provide reassurance, but always base the information on the data and evidence that is currently available, and acknowledging that this is changing, that this is evolving, and that as new data becomes available, the science is evolving, that this new information will be provided to the public. It will be updated, and it will also inform the policies that you are implementing. I think that is extremely important and is one of the major factors which can make a difference in how the community actually responds to the messages, whether it is to do with adherence to masks or whether it is to do with vaccination. A lot of the response in countries really depends on how information is conveyed, and to what extent the communities are engaged in those programs. As far as Ayurveda, which is could be considered a traditional medicine, one of the major global fields of traditional medicine, would be offered, from the WHO's point of view, traditional and complementary medicine should be offered as part of an integrated, universal health coverage program and as part of a integrated healthcare delivery in a well-functioning, people-centered health system that balances both curative and preventive services. So traditional and complementary medicine is an underestimated health resource in many countries. And while its use and benefits are well recognized in the so-called lifestyle diseases or non-communicable diseases, it would also help a lot in meeting the needs of the aging population and potentially also in improving the quality of life, in boosting the immune system, and in providing an additional intervention in the promotion of health and well-being. And as you know, the WHO's global program of work, which runs up to 2025, really focuses on healthy lives and well-being. So we talk specifically about well-being and not only about the absence of disease or the treatment and prevention of diseases. So it's a much more holistic approach to health, which includes everything from preventive and promotive health services to, of course, the diagnostic and curative services, to rehabilitation, to palliation, covering mental health, covering all the risk factors and determinants of disease. And I think Ayurveda also believes in the same type of holistic approach to health. So that way, I think we are very well aligned. The choice of appropriate health services, of course, one part of people-centered health systems. So the choices that millions of people make every year to choose between allopathic and other forms should be based on good information as well as high quality health services being provided to people so that they can make an informed decision about which type of medicine that they would like to. And of course, this would vary for different conditions. And for certain conditions, Ayurveda may be the most optimal. For others, clearly allopathy would have its advantages, and one needs to recognize that, and people need to be informed. So again, the issue of health literacy, it's not one system versus the other system. How can all the systems play an important role, really, in helping, the goals of healthy life and well-being for people? We have, of course, different forms of traditional medicine in different parts of the world. We have Ayurveda in South Asia, India, Sri Lanka, Nepal, etc. We have the traditional Chinese medicine systems that are prevalent in China and Korea and Japan. And India, of course, has a huge workforce of Ayurveda practitioners as well as practitioners of other traditional medicine. And therefore, there is a potential of utilizing this field towards the attainment of universal health coverage, which is something that India has committed to. In terms of the immune system, as I spoke about a little while ago, you have different arms of the immune system. You have the innate immunity, which is the one that really can be boosted up by different ways in which before you are confronted with a disease or a pathogen, you already have a strong innate immune system, which helps you to actually fight any particular virus or other pathogen. The adaptive immune system, of course, comes in only once the body has already seen a particular pathogen and then starts to react to that. So anything which reduces immunity, and we know the links between the neurocognitive and mental health status as well as immune systems. This has been something that there's been a lot of research on. And we know that if somebody is severely depressed, even if they may not have any physical ailments, that their immune system would be depressed. We know that many diseases, including diabetes, and of course other common infectious diseases, can suppress the immune system either for a short period of time or for a longer period of time. Many drugs can do the same thing, suppressing the immune system. So there are many conditions out there which impact the immune system. And so we need to counter that by seeing what are the forces which can actually strengthen the immune system. So what we need really are these studies to prove that this is feasible. So you need a hypothesis first to study, to test. And the hypothesis could be that a certain intervention boosts the innate immunity and thereby protects you from getting, X or Y infection. That needs to be tested at the community population level in a large, well-conducted, randomized clinical trial. Smaller studies, observational studies, case control studies may be good to generate hypotheses, but they are not good enough to prove the case. So you can generate hypotheses by observations by one particular physician or one hospital observing a certain phenomenon, but then that phenomenon really needs to be tested in a well-designed trial. And as we have seen in COVID, that many drugs that were proposed to have a mode of action and that were thought could be helpful either for treatment or prevention of COVID, when the actual randomized trials were done, most of those drugs turned out not to have any impact whatsoever, either on mortality or on progression of disease. So you must always, of course, start with a basis, which is based on some, rationale. You have to have a scientific rationale to test something. But once you have that, you need to be able to undertake those kind of studies. And there is huge potential in India. And I know that the ICMR itself has been involved in the past in several studies of Ayurvedic interventions for diseases like diabetes, as well as for anal fissure, and more recently for dengue. And once an intervention is proved to be successful, then it makes it much more easier to scale it up. And also there is much more enthusiasm behind scaling up something for which there's clear evidence. So there is, of course, historical knowledge that the traditional systems have, which has come down through generations. But now that you also have other systems of medicine, the allopathic system of medicine, which may or may not be offering some interventions for the same disease, it will be important to do sometimes maybe even comparative studies to see which one is better in a certain condition or situation. And always we have to keep in mind that there will be situations where one would be preferable to the other, or there could be situations where both could be used. Allopathic and Ayurveda could be used in a complementary to have a synergistic effect. So we know also that I would like to remind everyone that a few months ago, the WHO's Director General, Tedros, announced, along with the Prime Minister, Sri Narendra Modi, the creation and the establishment of a global center for traditional medicine in India. We are very, very happy that such a center in India would provide the opportunity for people and researchers, not just in India, but globally, who are interested in traditional medicine, to really collaborate, to work together, both in the generation of evidence, in the generation of normative and standard-setting products, frameworks for the assessment of such traditional medicine products, research protocols, but also the synthesis of evidence that can then feed into policy making. So I think this is a huge impetus for traditional medicine for the world. And the establishment of such center in India will really give a boost to traditional medicine, particularly in Asia. It is the responsibility of the global community to see that there is appropriate use of traditional medicine, and it is also a responsibility of the stakeholders. So we need the right kind of research, the right kind of clinical practice. We need to study and report on the benefits and the safety concerns, appropriate communications, the impartial assessment of impact, which has to be free of all conflicts of interest, appropriate policies, and of course, the strengthening of human resources and infrastructure. All of these are absolutely key to attaining the goal of the full utilization of the potential of traditional medicine, including Ayurveda. So it would be really important for this community to really take the lead, to embrace all of these desirable elements that can then work together to really make the field of Ayurveda even stronger, the evidence base even stronger, at the same time building the capacity, building the human resources. And I would like to assure everyone that the World Health Organization is committed to working with traditional medicine, Ayurveda practitioners, and research institutes. Particularly, I would like to commend the Ministry of Ayush for taking up this responsibility of the global center, and the WHO looks forward to working together jointly to make it a success. Thank you very much, Namaskar.
Thank you, Dr. Saumya Saminadhan. It was extremely eye-opening remarks made by you. I see from the epitome of modern reductionistic science, the way it has emerged as one of the most dominating science of the world, contributing in many of the areas of critical importance and interest and contemporary relevant, and also giving us a openness to see how traditional systems of health systems can peep in and get in and involve. And the last four sentences are very important for Ayurveda community. You are talking about appropriate communication, appropriate research, appropriate clinical practice, and appropriate assessment. I think this is one of the important, these are the important pillars on which we have to build the integrative medical system, which we are all looking at it. All of you, and I am sure Dr. Saumya will agree that today we are in a state of summative science, where two sciences are looking at each other. There is no integration actually happening. And integration has become a objective and an aim and a motto rather than a process that is happening today. And I also love to recognize and acknowledge that the last part of your speech, which is giving us a challenge how we should involve systems like Ayurveda. Ayurveda happened to be one of the dominant systems in this country with more than 5,000 years of unbroken history. And I am sure with your involvement and your last word of commitment that WHO will be happy to collaborate, and our Honorable Prime Minister has given us an opportunity through this global center of excellence in traditional medicine going to be part of WHO initiatives in India. It will kickstart many such initiatives. And I see here a bridge being built between the most reductionistic science of efficiency. I am not putting it as a remark, but it has efficiency and the scope and potential of the great knowledge system of India, which can comprehend many of the emerging things, especially lifestyle diseases and other things, which you are very clearly earmarked. I'm extremely happy for your time, and I am with this very few concluding remarks, which does not imbibe all the essence of what you gave us in 30 minutes. I'm sure it will become part of our proceedings. Now, let me thank you once again on behalf of the organizers, CISA and GF team and other partner organizations and Ministry of Ayush. And I'll request Dr. Manoj Nesiri, a Vaidya of great reputation as a clinician, and he is also an administrator also today, and he is an advisor to the Ayush Ministry, to give his version. So I hope this will be a linking bridge between the two sciences, and that is why, that is the reasons, one of the reasons that we put these two speakers together in the first inaugural plenary session. Thank you and welcome, Dr. Vaidya Manoj Nesari.
Namaste. Thank you, Vaidya Gangadharan, for this introduction, and I'm also thank you for putting Dr. Saumya Saminadhan from WHO at the opening part of this inaugural session, because these are the two angles, that is the Western medicine and the traditional medicine, how actually they can work together and they can complement each other rather than being the competitor, and how they can work together. And it is really very important to understand that one system, it cannot be assessed on the parameters of the another system, and there could be different parameters, but at the same time the goal of the all the systems of medicine in the world, so they are there to improve the quality of life, the humanity, and the overall health. So with this, I would like to share this presentation in which we have tried to demonstrate that how the immunity actually it works in improving the overall health of the people, and what Ayurveda can do to a great extent for the people of not only of the India but all the world. I hope the presentation is seen.
We can see it.
Yeah,
Yes.
thank you. So it is important that the optimizing his host defense mechanism, this the topic that the organizers they have selected. This is a very important topic, and this topic is not only important in the case of pandemics or the infectious diseases or the epidemics, but it is also important for the non-communicable diseases, the other diseases, and so on. So this is really very important topic that you have selected, and we appreciate this initiative. And in this, I would like to mention what Ayurveda mentions about this Vyadik Shamatva, or the whole defense mechanism. The Vyadi word is the disease, and the the Vyadik Shamatva is how actually we can prevent the onset of the disease, or how we can protect our body. And Ayurveda has given the two parts of this Vyadik Shamatva, that is the Vyadik Shamatva Nama Vyadi Bala Virodhitvam and the Vyadi Utpada Pratibandhakatvam cha. So the word this Vyadi Utpada Pratibandhakatva, that is to prevent the manifestation of the disease itself. And it is not only the manifestation, Utpada is the process of developing the disease. So it is stopping the development of the disease itself. As all of you know, those who are from the Ayurveda side, that there are 6 stages of the pathogenesis which actually traverses according to Ayurveda. It is the Vedic Shamatva. So this talks about the preventing the progress of the pathogenesis in all these 6 diseases. So all these 6 stages of the Samprapti, whether it is in the very initial stage or the Pragopavastha, or whether it is the Prasaravastha. So all the 6 diseases. So when we are talking about the Vyadi Utpada Pratibandhakatva, that is the stopping the process of the pathogenesis in any of the 6 diseases, or even before the pathogenesis starts. So this carries the both the meaning, and at the same time Vyadi Bala Virodhitvam. So Vyadi Bala Virodhitvam means against the disease. So it also works to treat the disease, to cure the disease, and to pacify the disease. So this is a broad term of the Vedic Shamatva, and it is applicable to the promotion of health. As I mentioned, it is the for the communicable diseases, non-communicable diseases, and many more conditions. There are various factors responsible for the Vedic Shamatva, and we must understand that Dr. Saumya, she was mentioning about the innate immunity. And when we are talking about the Vyadik Shamatva, it is beyond the immunity. And in Ayurvedic term, the dosha samya is one of the important factor. The Agni or the metabolism is another important factor. The dhatu sarata, that is the quality of different tissues. So this is also very, very important, because say for example, if we are talking about the present pandemic of the COVID, which is a multi-system disease, now we understand, but the primary manifestation almost in most of the cases, it starts with the rasadushti. And when we talk about the rasadushti, so the fever is one of the presentation, but at the same time, in many patients, the cardiac manifestation was also seen. The ST depression was also seen, which again could be because of the rasadushti. So there are various presentation, but the fever could be one, the fatigue could be one. So the rasa dhatu is definitely there, and because of that, the optimum quality of rasa dhatu to begin with is very, very important. And those various disease conditions, those who have the compromised the quality of the rasa dhatu, so they are prone to get these kind of diseases, or I would say this specifically to the COVID, and that's what we are calling as the comorbid conditions. The next factor is the oja, and the oja is another concept which is described in Ayurveda. Those who are from the Ayurveda background, those who are having some knowledge of Ayurveda, they would be able to understand easily what the oj is. And there are various methods how actually we can improve the oj. And one of the method is that you improve the quality of all the dhatus, and that will improve the quality of oj. And at the same time, the various diseases like the diabetes mellitus and the cancer and other, so in those kind of diseases or the tuberculosis, the oj is already depleted. And the manas, that is the mind, is another factor which is very important to maintain your Vedic Shamatva. And we know that the psychosomatic these diseases are there, but the importance of mind, and when we are talking about the mind, so that also include the various stress factors and other things which are very much responsible to deplete your Vedic Shamatva or the host defense mechanism, and that also should be equally good. So considering all this, the ministry had issued the guideline during this pandemic, and these guidelines, they are based on this particular shloka which you see in the blue color, and these are the methods how to achieve the Vedic Shamatva or how to improve the host defense mechanism. And this is Nityam Hitahara Vihara Sevi. So Nityam is regular. It is not only once, or it is not once a day or once in a month, and it is not so. It is Nityam, all the time, regularly. So Hitakar Ahar. So there is a lot of discussion is there. What is mean by the beneficial diet? What is the mean by the nutrition? So all this description it is there. And but these various guidelines, they have to be followed regularly every time. So Nityam Hitahara, and it is not only related to the diet, but also the Vihara. Vihara is also very important. Vihara is our lifestyle, that what time we get up, what in the morning, what time we wake up, whether we have clear bowels and all other systems clear, what time we go to sleep, whether do we do the exercise. So all these various factors, and including whether our mind is calm and cool and quiet, or whether we are under stress. So all these various factors, so they are there in the Vihara. So the Hitakara Vihara is also very important. There are lot many research papers which are already published, and they are available in the journals, giving the impact of the stress, giving the impact of the lack of sleep, and how actually it impacts the overall system of the human body. The circadian rhythm research paper, it was recently published 2 years back, and it also got the Nobel Prize. So all these various mechanisms and the various principles which are there in Ayurveda, so they fall under the category of Nityam Vihara also. So Nityam Hitahara Vihara Sevi Samikshakari. Samiksha, that is, you have to analyze that what is good and what is not good. Samikshakari and Visheshu Asaktaha. So that means there should not be excess of indulgence. So this each and every word is very, very important. Visheshu asakta, we should not get excessively indulged in any kind of object, any kind of, whether it is the our work, whether it is our lifestyle, whether it is the food, whether it is the money, or whether whatever it is. So in any kind of subject, we should not get excessively attached to it. So that is very important. And the second line is very, very important, considering the mental aspect, and not only the mental aspect, the spiritual aspect also, because it says that one should be data, we should have the tendency to donate, we have the tendency to give, and this is very important. So dataha samaha, we should look at everybody equally, so that there should not be any stress. If we favor somebody and if we hate somebody, so that will give rise to some kind of stress. So these data samaha satyaparaha kshamavan aptopasevi cha bhavati arogaha. So these are the methods how to be healthy, how to maintain our health. And there are also the characteristics how actually we can assess whether somebody is healthy or not. And these characteristics, these are mentioned over there. These are the actually parameters. In the definition of Ayurveda, it has said that what is Ayurveda? So at the end of this shloka, the Charaka says that Manam cha taccha yatharokta. Manam is the quantification. So whatever the various advices and the rules and other things which are given in the Ayurveda, so at every time there is method to quantify, to assess. So all these assessment methods, they are also there. These assessments methods have been described very clearly, and these are the quantification methods. So here also the characteristics, that is how would you assess that somebody is having good defense mechanism or not. And here it is mentioned that samamausa pramanastu. So the distribution of the muscles, it should be and their presentation, it should be equal. The overall the body presentation, it should be equal. The it is given in the anthropometry that what should be the overall measurements of each body part. So when your body is proportionate, so that automatically gives you the Vedic Shamatva, or the whole defense mechanism is good. So this is the overall the samamausa pramanastu sama samhono naraha drudendriyo vikaranam na balena abhibhuyate. So this is very important, that vikaranam na balena abhibhuyate. So they do not fall sick very easily. So this is one of the actually reference which is directly there in the ancient text, that when you have good Vedic Shamatva, when you have good host defense mechanism, in that case you do not fall sick very easily. So this is very, very important. And on these two slides which I mentioned, on this basis the Ministry of Ayush during this COVID pandemic, it created the guidelines for the community, that how actually you should improve the immunity. And I am happy and proud to share with all of you that probably the Ministry of Ayush, Government of India, was the first one in the month of February 2020 to these issue guidelines to improve the general immunity of the people to keep themselves safe during this COVID pandemic, because nobody at that time knew that what kind of the disease it is, what would be the medicine, whether we can prevent it or not with any kind of vaccine. So nothing was available that time. So that time the Government of India, Ministry of Ayush came forward and issued the guidelines. And these guidelines, they also mention about the overall hygiene, the safe distancing. Now this hygiene and safe distancing, they are also rather the principles of Ayurveda, because Ayurveda knew that how the infectious diseases they occur. It is said that prasangat, gatra sansparshat, nishwasat, sahabhojana. So gatra sansparshat, that is by touch, and the nishwas is by breathe or the droplets. So all these mechanisms, they have been described in Ayurveda. And the overall this guidelines which were promoted by the WHO, and the same were being promoted by all the countries, including the Ministry of Health and Family Welfare of the Government of India, as well as the Ministry of Ayush and the various offices of the government. So these knowingly or unknowingly, they actually promoted the guidelines of Ayurveda. And at the same time, the use of the rasayana herbs, the prophylactic care, the add-on or standalone mild to moderate cases, and this lifestyle and yoga. So these were the various aspects of the guidelines that the ministry promoted, and that include drinking the warm water throughout the day, use of the concoction made up of basil, cinnamon, ginger, pepper. Now there are a lot many research papers which are available on these all various kind of medicinal plants, whether it is ashwagandha, whether it is ginger, that how they improve the immunity of the people. So all these they are well published. At the same time, the very novel intervention the ministry promoted, it is the nasal application of the medicated oil. And there are also, we are now conducting the research with the Department of Science and Technology on the Nasya method, that how actually it creates a barrier and that prevents the entry of the virus through the nasal mucosa. So this is the very innovative mechanism that the Ministry of Ayush brought forward, and the Chyawanprash, and there are a lot many papers which are already available on the Chyawanprash and Amla, that how it improves the host defense mechanism as well as the innate immunity. And these guidelines, they were promoted throughout the country, and not only throughout the country, but with the help of the Indian missions throughout the world. And these were followed by almost 90 to 95% people in India. And we conducted a huge study through the mobile app on this, that how many people they actually really followed this and how much they benefited. And you would be happy to see the interesting observation that more than 135 million people, they submitted their feedback regarding this following, and 89% people, they said that they have benefited with these guidelines. So this is a huge response that the community has given to the Ayurveda intervention. And it is not only that, beyond that, we also conducted various studies and the hardcore research trials, whether they are on the prophylactic or whether they are on the curative side. And these are the various results that I would like to show. Now, in this particular intervention, the Ayurvedic intervention was given like the ashwagandha, as well as the Tinospora cordifolia, that is the guduchi or the Samshoni vati, in the Delhi population. And on this blue graph, blue line, you can see that the overall incidence of Delhi population, it was increasing. At the same time, this intervention was given in the population in the containment zone, and in that population, this graph, it showed that how it dropped down. So on one side, in the Delhi population, the incidence was increasing very drastically, and at the same time, at the end of the fourth week, the incidence in this containment zone where the intervention was given, so it dropped down significantly. At the same time, we also tracked the symptom-wise how actually they improved, and here actually you can see this blue line, blue graph, so that indicates the Ayurveda intervention, that is the Ayush 64, and the red line, so this is the standard care. And here you can see that how the Ayurveda intervention, it has helped significantly. And these are very large population. There, all the population, this sample size in thousands. And here everywhere you can see that how significantly it helped to improve their not only immunity but improve the overall response to the COVID. And at the same time, we also conducted the hardcore scientific studies, and in that, out of 36 compounds from the various ingredients, there are 4 ingredients in the formulation I-64. So the 35 compound, they exhibited good binding energies than the positive control of the N3. So these studies that also we conducted in the initial studies, and to find out that whether our logic is correct and whether we should go ahead with this. And this demonstrated that the logic of the ministry, so that was very correct, and it would definitely help. And with this, we intervene when the, to improve the immunostimulatory response of the people. And here also in this graph, you can see that how it improved. That this is in the Delhi police. The intervention was given to 80,000 Delhi police, and this was continuously given for 2 months. And here actually you can see that the overall, when the peak was there, so at that time the overall incidence in the Delhi police, it was hardly 6. So this was the outcome of the intervention, and that showed that how the immunity improved. And we have also taken these samples, and they are being analyzed that to find out what were their responses to of the various biochemical parameters as well as the other parameters, and how they improved, with including the immunoglobulins and other things. One interesting thing I would like to show here, that during this pandemic, in the All India Institute of Ayurveda, the incidence of the COVID-19 in the host in the healthcare, or those providing the services. So in that it was zero. So it is very important that out of 200 people, those who are providing the services in the COVID ward, none of them they caught the infection. This is another data, and at the same time, it is important to see that in other hospitals where the COVID care was given, so there the incidence of catching the COVID in the healthcare providers was almost 30%, whereas here not a single case it actually got the COVID. So likewise, all these various data are there. This is the data which shows that how the RT-PCR it was quickly negative. So compared to the conventional method, the RT-PCR, we found that within 7 days, the people with the COVID positive, so they become RT-PCR negative. So the symptoms they become negative, or the people they become asymptomatic within 2 to 4 days, depending upon the intensity of the symptoms, and they become COVID negative within 7 days. So this is again a very important observation that I would like to share with you. And at the same time, we also conducted the studies on the other Ayurvedic drugs, that how actually they improved the immunity in the healthcare worker, and these were the exploratory studies, and they showed that the various parameters like the hemoglobin percent was increased, there was an increase in the platelet count, there is increase in the serum immunoglobulin G level, which scientifically demonstrates that the immunity was significantly improved. And this is one more slide which I would like to share with you. And this is again 11,964 patients, they were treated of mild to moderate category, and this was managed by ITBP, that is Indo-Tibetan Border Police Force, in the Sardar Patel COVID, and they were given the Ayurvedic decoction and the Chyawanprash and the turmeric milk, and this is the data that how they actually responded. So out of this 11,964 people, so 11,594, so they totally cured and they were discharged. So this is a huge, so very good clinical improvement was seen in the patients, that is 96.9%. So this is the huge the response that we received, and this shows that how the Ayurveda intervention can improve your host defense mechanism. So thank you very much. Thank you.
Thank you very much, Vaidya Manoj Nesri, for a very, very accelerating presentation of the scope and potential of Ayurveda. With the limited study I could do in the given time of this pandemic, and I think the two studies which we have quoted, I am sure it will get published soon in some good journals of repute, so that it will get spread. But two things what we would like to note here is the percentage of success that you have been quoting, 96.9 and 85, and feedback from the population that about 85.9 positively responded to the advices of. It shows that Ayurveda, it is not a textual science, it is science of the people. People's lifestyle, it is lying. Only thing is we have to just kindle it. We have to just augment it. We have to just encourage them to put into use it again. There is a break in the tradition somewhere, sometime. And I think this pandemic has given us a chance to rejuvenate the earlier traditions that has been slowly declining in our health traditions. I'm sure these two presentations of today, plenary, is giving us a scope for a bridging exercise. Some of the parameters that Manoj has selected for acknowledging the efficacy of Ayurvedic interventions are the parameters accepted by modern biomedical science. So this is the way one may like to get into the bridging activity bridging business so that integrative science slowly will emerge. I don't want to take much of your time, but I am sure these two papers will give us the direction to the further areas of our discussions in the coming days. Now, let us get into the formal inaugural session of this great event. And I would like to take you to a different format, which is being enriched by who is who in the field of Ayurveda and allied sciences, and Ayurveda and people who are supporting and trying to encourage this great system of India's tradition. With a few words, with the permission of our industry partners and our colleagues, I get into the important area of inauguration.
Yeah, maybe Dr. Gangadharan, you may ask if I may ask all the speakers to switch on their videos so that we.
Yes. May I request all the plenary session members switch on their video and switch off their audio so that we get a better clarity of speakers. Shall we start?
Please, Dr. Gangadharan, you may start.
Today is a historic occasion for the global Ayurveda community and for all of us at CISA. The fourth edition of Global Ayurveda Festival is getting kick-started now in a high-end virtual platform powered by FICCI. Sri Uday Shankar, President FICCI, will deliver the welcome address. I acknowledge the presence of Mrs. Sangeeta Reddy, the immediate past president of FICCI, and I also acknowledge the presence of Vaidya Rajesh Kotecha, the Secretary of Ayush. We have two important speakers from the ministry, followed by the great talk by our Honorable Prime Minister. Honorable Sri V. Muralidharan, the Minister of State for External Affairs and Parliamentary Affairs, Government of India, and who has also been at the forefront of our efforts to host this event in this form, as the chairman of Global Ayurveda Festival will give the first delivery. Honorable Sri Kiran Rijiju, Union Minister of State, Independent Charge for Youth Affairs, Sports, and presently Ayush Minister in charge, and Minority Affairs, who has been very supportive of our efforts, will be giving the second talk. We then have the rare privilege and honor to have somebody whom many rightly consider as destiny's gift to Bharat, destined to enable her to achieve her pristine glory that she rightfully deserves, and arguably the tallest leader in the history of independent India, Honorable Sri Narendra Modi ji, the Prime Minister of India, the beacon of hope for millions of Indians in India and across the world. I believe it is an auspicious sign for Ayurveda that Sri Modi ji has chosen to inaugurate the fourth GAF by finding time for Ayurveda from his extraordinarily busy schedules. I would like to use this momentous occasion to present a preamble of the idea Ayurveda and its contemporary relevance, which is at the core of what we aim to achieve through organizing this global Ayurveda festival regularly. World is fighting an unprecedented war against a global pandemic which has put extreme pressure on conventional healthcare systems, which was already reeling under the impact of the double burden of non-communicable diseases and drug resistance. Healthcare strategies globally is undergoing a great churning and transformation. It is currently at crossroads, signaling to the impending revolutionary changes that will forever change the way healthcare is perceived and practiced across the world. Although it would be premature to predict the contours and the directions that these revolutionary changes would bring about, there are a few clear facts emerging that give us enough reason to believe that holistic fundamentals of Ayurveda with a strong focus on prevention and health promotion can potentially bring game-changing advantages for India to gain pole position in the fast-changing global landscape if we play our cards well. Conventional healthcare as practiced today, with its focus on one medical system, is unable to address all healthcare problems of modern times. The US spends close to 18% of its GDP on healthcare with questionable results in universal coverage and improvement of people's health. So clearly more spending is not translating to better healthcare outcomes. A WHO report analyzing data from 143 countries found that government spending on health is constrained by government fiscal space. Therefore, even as we know that our healthcare spending needs to go up from the current sub 4% level, given our fiscal constraints, we cannot afford to increase the spend on healthcare beyond a limit, and never to levels of the developed world. So even in increasing healthcare spending, where a solution which is evidently not so, we cannot afford to do it. Therefore, what we need is a healthcare system that delivery models that will work for us. Something that is tailor-made to address our specific needs and challenges. We believe that Ayurveda can make far-reaching contributions in the following areas: developing low-cost preventive healthcare solutions for the urban and the rural poor, developing novel biological targets and pathways in the field of medicine, especially for non-communicable diseases, through research that combines fundamental theories of Ayurveda like Tridosha Siddhanta and cutting-edge science. What we need for this to become a reality are the following pragmatic decisions from the Government of India: a dedicated cell in the Niti Aayog to strategize and plan long-term interventions in our healthcare system to harness the strengths of the holistic theories of health articulated in Ayurveda, like mentioned by Manoj Nesri right now. Support at least 10 high-impact projects that will bring together the best of medical talent across the country, targeted to achieve a Nobel Prize for Medicine from India in the next 10 years. A bold public health strategy that recognizes clinical outcomes in the field rather than evidence from the controlled studies, which are known to be skewed against holistic system like Ayurveda. That was the biggest curse faced by Ayurveda in last 50 years, trying to make evidence in a different platform which is not endemic to Ayurvedic science. And overall of the current educational system with clear focus on clinical excellence, imparting foundational knowledge of Ayurveda and research, like mentioned by Dr. Saumya Saminadhan just before a few minutes. An IIT-like institution for Ayurveda, focusing on developing best practices, R&D, integrative management protocols with measurable outcomes, and facilitate training of the trainers. It is all our earnest belief that Sri Modi ji, who is not only for his visionary leadership, but also for his eagerness to listen to every stakeholder and take bold decisions, will take note of our humble submissions. I would like to conclude my words without keeping you waiting any further from the rare opportunity that all of us have been waiting for with bated breath. Thank you all. With this very brief introduction to the expectation, scope, potential, and the effort of all the Ayurvedic stakeholders in this country, I open these plenary sessions for all of you with the brief introduction. Now I request Sri Mr. Uday Shankar, President FICCI, to offer the formal welcome to this plenary session.
Thank you very much, sir. Good evening, everyone. Honorable Prime Minister Sri Narendra Modi, Sri V. Muralidharan, Honorable Minister of State for External Affairs and Parliamentary Affairs, Sri Kiren Rijiju, Honorable Minister of State, Independent Charge for Youth Affairs and Sports and Ayush, and Minister of State for Minority Affairs, Vaidya Rajesh Kotecha, Secretary Ministry of Ayush, Dr. G. Gangadharan, President CIISSA and Secretary General Global Ayurveda Festival 2020, Dr. Suresh Kumar C., General Secretary, CIISSA and Chief Coordinator, 4th Global Ayurveda Festival, my colleague and immediate past President of FICCI, Dr. Sangeeta Reddy, ladies and gentlemen. It gives me great pleasure to welcome you all to the 4th Global Ayurveda Festival, virtual conference and expo. With the participation from over 60 countries, 100 plenary speakers, more than 100 exhibitors, 600 research papers, it is the largest virtual platform on Ayurveda. It is an absolute honor for all of us that the 4th Global Ayurveda Festival is being formally inaugurated by none other than Honorable Prime Minister Sri Narendra Modi. Ayurveda is, FICCI is delighted to partner with Center for Innovation in Social Science and Social Action in co-organizing the 4th Global Ayurveda Festival. Ayurveda, as one of the most ancient and well-documented systems of medicine, equally relevant in modern times. The Sanskrit term Ayurveda translates to knowledge of life, and the principles of this ancient wisdom remind us that the entire web of life is intricately woven. The pandemic in several aspects has challenged healthcare systems across the globe and has turned the world's attention to our immune system. In Ayurveda, several treatment options are available for enhancing our immunity against the respiratory illness. In India, several initiatives were taken to utilize the vast potential of Ayurveda during the pandemic. The Ministry of Ayush, Government of India, is doing a great service to the humanity through this unique medical system. While the world struggles with the side effects of many medicines, Ayurveda provides a holistic response to many diseases with almost no side effects. Honorable Prime Minister himself is an advocate for the traditional way of healthy and balanced living. Prime Minister Modi, during his address at the 3rd Ayurveda Festival, had mentioned, and I quote, "These systems were based on the philosophy of Sarve Bhavantu Sukhina, Sarve Santu Niramaya. That is, all should remain happy, all should remain healthy." Ayurveda is generally defined as science of life by translating Ayur as life and Veda as science. We are grateful to Honorable Prime Minister for his continuous support and agreeing to inaugurate the 4th Global Ayurveda Festival, which is perhaps the biggest virtual festival in the Ayurveda sector. I'm sure the 4th Global Ayurveda Festival will inspire many people across the world to look towards Ayurveda to preserve health and wellness by keeping the mind, body, and spirit in balance. Thank you.
Thank you, Mr. Uday Shankar, for your kind words. May I invite now Mrs. Sangeeta Reddy, the immediate past president of FICCI and joint manager director of Apollo Group of Hospitals, to deliver a few words of her appreciation, who has been with us from the initial state of our activity on this GF since last 1.5 years. Thank you, madam.
Namaskar and good evening. It is a great pleasure for me to see the culmination of so much dedicated effort, so much inspiration towards the concept of Ayurveda into today's wonderful platform. I believe that today's conference and the platform will help to evolve and emerge the powerful science of Ayurveda into helping humanity towards better health. It is a significant thought that the concept of the scientific validation of Ayurveda and the integration of Ayurveda into mainstream medicine is a significant responsibility for India for the sake of humanity. Seeing what with the wonderful and inspired leadership of our Honorable Prime Minister the entire government, the public and private sector. India is acknowledged across the world. I look forward to Ayurveda following the same path and continuing to serve humanity. I commit on behalf of Vicky and my own organization, Apollo Hospitals, that we will do whatever we can towards this inspired goal given to us by the Honorable Prime Minister. Thank you all very much. Wishing the conference all the best. Namaste.
Thank you, Mrs. Sangeeta Reddy. May I invite Honorable Union Minister of State with independent charge for Youth Affairs, Sports and Ayush Minister in charge and Minority Affairs, Sri Kiran Rijiju, to deliver his address for this platform. Thank you.
Thank you very much. Namaskar. I am extremely delighted to be part of this extremely important, the 4th Global Ayurveda Festival. And on this occasion, Honorable Prime Minister will be giving video message, and my colleague, Sri Muralidharanji, will also give his message, and the very learned Secretary of the Ministry of Ayush, Vaidya Rajesh Kotejaji, Mr. Uday Shankarji, Dr. Madhavan Kuti Veriyarji, Dr. Sangeeta Reddy ji, Dr. G.G. Gangadharan ji, and all the learned people who have joined from India and from across the globe. I have been in charge of Ayush Ministry for a little time, but I have understood in this short time how much our people have devoted and how much learned people are working to ensure that Ayurveda becomes part of our daily life. It is something which I can say it's a gift of India to the world. And this 4th Global Ayurveda Festival being held from 12 to 19 March 2021 is being held a high-end virtual platform, but it will not dampen the spirit. Even though we are meeting virtually, but it will galvanize the entire sector and especially our young minds. We all know India is amongst the 17 mega biodiversity countries, and India contributes about 7% of the world biodiversity. And the place where I come from, northeastern part of India, is also being declared as one of the hottest biodiversity spot in the world. So the tremendous potential which we have can very well be understood. And more than 7,000 plant species have been known to be used as medicinal plants in India, which has 15 agroclimatic zones. Ayurveda, the oldest living medical traditions of the world. It has widespread acceptance in India, and the domestic demand of medicinal plants has been estimated over 195,000 metric tons. It is also estimated that the export demand of medicinal plants is about 134,500 metric tons, with export value of over 3,211 crore. So you can imagine the scale of its potential. The emerging or re-emerging viral disorders are possibly the most important threat the humanity is facing today, and to address this, World Health Organization has already requested traditional medicinal system, all traditional medical systems, to come up with new range of antibiotics from their arsenal in view of drug resistance. On this background, the importance of Ayush system not only to provide research inputs for new antivirals and antibiotics, but also to provide lifestyle measures for improving the host resistance. The lessons which we have learned from managing COVID-19 and post-COVID conditions in Ayurveda are quite significant for the whole world. The low mortality rate and high recovery rate of COVID-19 in India is already debated among health system researchers. Though there could be several factors, including demography and environment playing a role here, however, our lifestyle and food habits, especially the use of species like haldi, turmeric, and sondh, ginger, have definitely contributed in this regard. In the current age, we know the importance of a healthy lifestyle. Yoga and Ayurveda are the solid options looked upon globally for attaining this. We should position ourselves to deliver this and to improve our share in emerging global wellness movement. The National Health Policy of India aims to provide universal access to good quality health care to all citizens through increasing access, improving quality, and lowering the cost of health care delivery. Medical pluralism is one of the key principles of the new policy, and I note with satisfaction that Global Ayurveda Festival have received bipartisan support from governmental and non-governmental organizations and from colleges, academicians, practitioners, researchers, students, and public alike. Initiatives like Global Ayurveda Festival are thus the need of the hour. With several national and international sessions, this first online version of festival will bring together the whole world to discuss this. Global Ayurveda Festival has proudly represented and highlighted the rich Ayurveda heritage and has played a notable role in bringing together great tradition of ours and the global scientific community. I'm happy to note that the fourth Global Ayurveda Festival will be bigger and better than earlier editions, with a host of activities displaying the grandeur of Ayurveda. The program is expected to create the widest impact, and any program on Ayurveda has envisaged until date, with an expected 10,000 delegates, including 500 foreign delegates, particularly participating virtually in this international seminar. I'm told that there will be 50 plenary speakers, including 25 international experts, and nearly 50,000 visitors are expected to visit the 300 virtual stalls in the expo, and representation from 60 countries and many prominent international associations have also pledged their support. I'm told that there are about 600 research presentations and 500 poster presentations that will be made by Ayurveda students and researchers. The central government, through its ministries of Ayush, Tourism, Commerce and Industry, and the state governments, are the official partners of this event. I believe the program would not only help in promoting Ayurveda practiced in its purity in the country, but also evolving a roadmap for the development of the Ayurveda and allied industries in our country. The participation of foreign delegates will definitely help Ayurveda to get a stronger footing globally. Before concluding my speech, I would like to congratulate the Center for Innovation in Science and Social Action for organizing this monumental event and encourage them to come up with more innovative ideas for the sustainable growth and development of the country. Once again, I extremely feel privileged to be part of this very important conference. And this is something which every Indian takes pride in, this whole achievement, as well as this is a global asset. This Ayurveda, although it has come from India, but we feel it only doesn't belong to India, but it belongs to the whole world. So together, we will certainly go much further in ensuring a healthier world to make our traditional system of medicine truly a global system of medicines. My best wishes to all the participants, especially the young students and researchers in their endeavors. Thank you very much. Jai Hind.
Thank you, Honorable Minister Sri Kiran Raju, for your enlightening words. Especially what we noticed here is the need of getting into all stakeholders. And you may kindly notice that we have not left any stone unturned in the effort of bringing the stakeholders however in one platform. Probably Global Ayurveda Festival is the only event in which I should say 99% of the organizations, partner organizations partnered with either physically, mentally, intellectually, financially, or in whatever form they could. This is the largest event in terms of its participation, in terms of its reach to the people. And you may kindly note that around 14 organizations working in different parts of the world are as a group has joined, and they are all delivering different lectures in different groups in this coming 8 days. So it goes within few days of you taking charge of Ayush, the way you have understood this sector, it is highly astonishing. The trade that is happening in the medicinal plants, the industry, the way it is growing, and the future potential all have come into focus of your talk. We are extremely grateful for your kind words and taking busy time of your schedules. I understand today when we met last week that how busy you are today placed, but we made sure that you come in person in the virtual context and you are given your best words possible for this group. We will be in touch with you again for this program. This is an unending mission for people at GF. Thank you, Honorable Minister. I would like now to turn to one of the veterans of our team, our own Minister, Sri Muralidharan, who is very, very special to us because he is not only acting as a minister for us, he is the chairman of Global Ayurveda Festival. When we talked to him about the need of such a conference and the history of this conference for the last 10 years, he volunteered without much effort to become the leader. And we believe the leader is the one who gives the path, who gives the direction, and who leads us not in front of us, but with us. So last 1 year, many of you might have seen how he has been a comrade with us rather than a leader with us. So I have no words less to explain the energy and the strength that gave us to make this program a great success. All of you know Mr. Muralidharan has been a leader by birth. He has been a worker in the field, and he came to the students' movement and contributed a great in the students' movement, getting an identity of its own in the state of Kerala. And he has been an inspiring source for many of the groups working in Kerala, and he is now in the national state. And it is not a small thing for us because I should take time to tell about the CISA's untiring effort to get people like Sri Muralidharan to our fold, because it is the political leadership which can give shape to this kind of effort. Unless this kind of leadership come to help us, we won't be able to take it further to the people. So this has helped us a lot. And you can see the way the program has been scheduled, which is spread across 8 to 9 pages with 140 speakers and around 40 speakers from abroad. and who in the field is going to address, and the kind of participation we have is pan-India and pan-global. So that shows the effort and the sincerity that goes behind this effort of this monumental work. It's not easy to conduct such a program, bringing everyone into the fold. You might have noticed that industry partners who are the partners and who are the sponsors, the industry, the people who are in the field of medicinal plant cultivation, the people who are in the academia, people who are in the research, almost all organizations in the teaching and research field, especially from South, are partner of this program. With these few words of introduction, I am sure this program will take a great will become a great turning point in bringing Ayurveda to the limelight. And it is the right time for Ayurveda to come to the limelight, because we have seen from the presentation of Dr. Saumya how we are in the crossroads, how we are not sure as an international community that where to go, how to go, and which are the resources that are available to go further. The modern reductionistic science has very clearly told us we want new paths, we want new paradigm. All things are changing, the whole paradigm is changing, and this global committee, this global community will come together and will give us a lot of light to this thing. With these few words of introduction, and we would like to see that Sri Muralidharan's speech to deliver in this platform. I invite Sri Muralidharan to this platform. Thank you. Namaskar.
Honorable Prime Minister Sri Narendra Modi ji, Sri Kiran Rijiju, Union Minister of State, Independent Charge for Youth Affairs and Sports and Ayush, and Minister of State, Minority Affairs, Sri Vaidya Rajesh Kotecha, Secretary, Ministry of Ayush, Government of India, Sri Uday Shankar, President, FICCI, Dr. G.G. Gangadharan, President, Center for Innovation in Science and Social Action, Dr. Sangeeta Reddy, immediate past President, FICCI, and Joint Managing Director, Apollo Hospitals Enterprise Limited, panelists and speakers, Namaskaram and good evening. I am extremely delighted to address this inaugural session of the 4th Global Ayurveda Festival. I am particularly glad that the festival is being inaugurated by the Prime Minister of India, Sri Narendra Modi ji. Ayurveda literally means the science of life, is the oldest healing science in the world. It has its roots in the Indian civilization, and with advancements in knowledge, research and technology, Ayurveda has evolved into a mainstream system of medicine. While our focus for the last year has been on fighting a raging pandemic, we should not lose sight of the health needs of the aging population, especially those that are looking to alternate systems of medicine for solutions of lifestyle-related non-communicable diseases. Friends, traditional systems such as Ayurveda can help us achieve the Sustainable Development Goal 3 that talks about ensuring healthy lives and promoting well-being for all at all ages. Ayurveda is especially unique among the traditional systems, being a living tradition. Ayurvedic practices have pervaded the subcultures of India and has the highest practitioners to population ratio in comparison to any other place in the world. With increased awareness, there is renewed interest in Ayurveda, both in India and across the world. The government has left no stone unturned in promoting Ayurveda as a system of medicine. I am told that under the Ayushman Bharat initiative of Prime Minister Sri Narendra Modi ji, 12,500 health and wellness centers are to be developed by the Ministry of Ayush. These centers would be operationalized through states and union territories in centrally sponsored scheme mode and under the broad umbrella of National Ayush Mission. The vision is to establish a holistic wellness model to reduce the disease burden, out-of-pocket expenditure, and to provide informed choice to the needy public. Friends, through its history, Kerala has preserved, protected, and promoted the ancient practice of Ayurveda in its pristine form. This unbroken continuity and the contributions through the bhashyas or the commentaries and treatises and advancements in medicinal formulations and treatment modalities has ensured that Ayurveda in Kerala has retained its antiquity while also keeping up with the times. As we develop greater understanding of the functioning of the human body and the effect of factors such as circadian rhythms, seasonal variations, and different psychological states on the immune system, the value of Ayurveda in achieving a healthy life has become more apparent. Friends, from its inception in 2012, the Global Ayurveda Festival has played a significant role in bringing together the various stakeholders of Ayurveda from across the world on one platform in order to exchange ideas and share success stories. The Global Ayurveda Festival combines academic sessions, exhibitions, panel discussions, debates, public awareness programs, micro, small and medium enterprises meetings, and social participation, thus bringing together both the pharmacological as well as the commercial aspects, both theory and practice, both healing as well as marketing of Ayurveda. I am told that there are over 50 plenary speakers, including 25 international experts, and nearly 50,000 visitors are expected to visit the 300 virtual stalls in the expo representing 60 countries. Ayurveda students and researchers are expected to make about 600 research presentations and 500 poster presentations. I believe the program would not only help in promoting Ayurveda practiced in the country, but also evolving a roadmap for the development of Ayurveda and allied industries in our country. The participation of foreign delegates will help Ayurveda get a stronger footing globally. Let me take this opportunity to congratulate the Center for Innovation in Science and Social Action and FICCI in bringing together various elements of the festival despite the pandemic and moving it to the virtual realm, thus creating greater possibilities for participation of stakeholders from across the world. I wish the 4th Global Ayurveda Festival all success. Thank you for the attention.
Thank you, Muralidharanji, the External Affairs Minister, and our leader in this effort, for his kind words, highlighting the importance of GAF and importance of the work being taken by CISA for last 1.5 decades. I think now we are reaching to the epitome of this today's session, and we are all blessed with none other than our Honorable Prime Minister to address us. And it is overwhelming for all of us at the CISA and GF that it is second consecutive year that a Prime Minister of the country has chosen to inaugurate a monumental function of Ayurveda, which shows the great respect and regard that he carries towards Ayurveda. I am sure it is none of our personalities that is attracted. It is the greatness of this unbroken history of Ayurveda in this country has prompted our Honorable Prime Minister to address. And I am sure these initiatives by the leader of this country will go a long way in enriching our activities, in strengthening our activities, and promoting the Ayurveda, not only in India and globally. With few words of uncompleted word, introduction to a great personality, I now request our Honorable Prime Minister to deliver the inaugural address and bless all of us for the better, great future of Ayurveda in the coming centuries. Thank you.
Greetings to everyone. Namaskar. my colleagues in the ministry, Sri Kiran Rijiju ji, Sri Muralidharan ji, Global Ayurveda Festival Secretary General, Dr. Gangadharan ji, FICCI President Uday Shankar ji, Dr. Sangeeta Reddy ji. Dear friends, I'm glad to be speaking at the 4th Global Ayurveda Festival. It is wonderful to note that many experts are going to be sharing their views and experiences. The numbers of countries being represented is about 25. These are great signs. It shows a growing interest towards Ayurveda and traditional forms of medicine. From this forum, I would like to appreciate the efforts of all those who are working on Ayurveda across the world. Their passion and persistence will benefit the entire humanity. Friends, Ayurveda is closely linked to the respect Indian culture gives to nature and environment. Our texts have described Ayurveda brilliantly when it was said, Hita hitam sukham dukham, ayuhu tasya hita hitam, manam cha tasya yatra uktam, Ayurveda sa uchyate. Ayurveda takes care of many aspects. It ensures good health and long life. Ayurveda could rightly be described as a holistic human science, from the plants to your plate, from matters of physical strength to mental well-being. The impact and influence of Ayurveda and traditional medicine is immense. Friends, it is said, swasthasya swastha rakshanam, swasthasya swastha rakshanam, aturasya vikar prashamanam. It means, apart from curing existing ailments, Ayurveda also protects the overall health of the body. No wonder that more than rog, Ayurveda talks about nirog. Try to understand rog and nirog. Back in the day, if someone went to a Vaidraj, he or she not only got a medicine, but also a few mantras. Mantras like, भोजन करे आराम से, सब चिंता को मार, चबा चबा कर खाइए, वैद्य न आवे द्वार. It means, enjoy your food without any tension. Relish every bite of the food. Chew it patiently. This way, you will never have to call a Vaidraj home again. Friends, in June 2020, I came across an article in the Financial Times. The headline was, Coronavirus gives health halo products a boost. The piece referred to turmeric, ginger, and other such spices whose demand is steadily rising in the context of the COVID-19 global pandemic. The current situation presents a right time for Ayurveda and traditional medicines to become even more popular globally. There is growing interest towards them. The world is seeing how modern and traditional medicines both are important to further wellness. People are realizing the benefits of Ayurveda and its role in boosting immunity. People are making kada, basil, black pepper integrate parts of their lives. Friends, there are many flavors of tourism today. But what India specially offers you is wellness tourism. And I repeat again, wellness tourism. At the core of wellness tourism is the principle of treat illness, further wellness. When I talk about wellness tourism, its strongest pillar is Ayurveda and traditional medicine. Imagine yourself getting a detox in a lush green surroundings in the beautiful state of Kerala. Imagine yourself performing yoga by a gushing river by the mountain means in Uttarakhand. Imagine yourself in the middle of the lush green forest of the Northeast. If your life's deadlines and timelines are stressing you out, it is time to tap into the timeless culture of India. Whenever you want to treat your body or a retreat for your mind, come to India. Friends, thanks to Ayurveda popularity, a strong opportunity awaits us. We must not lose that opportunity. There have been many gains by combining the traditional with the modern. Youngsters are using a wide range of Ayurveda products. There is growing consciousness to integrate Ayurveda with evidence-based medical science. Likewise, other things getting popular are Ayurveda supplements, personal care products created around Ayurveda. The packaging of products has been greatly enriched. I would call upon our academicians to deepen research on Ayurveda and traditional forms of medicines. I would urge our vibrant startup community to specially look at Ayurveda products. One thing for which I want to specially appreciate the youth is that they have taken the lead to present our traditional forms of healing in a language that is globally understood. No wonder I strongly feel that the ethos of our land and the enterprise spirit of our youth can do wonders. Friends, on behalf of the government, I assure full support to the world of Ayurveda. India has set up the National Ayush Mission. The National Ayush Mission has been started to promote Ayush medical system through cost-effective Ayush services. It is also working to strengthen educational systems. It is also facilitate the enforcement of quality control of Ayurveda, Siddha, Unani, homeopathy, drugs, and ensuring sustainable availability of raw materials. The government is undertaking various quality control measures as well. Our policy regarding Ayurveda and other Indian systems of medicine is already aligned with the Traditional Medicine Strategy 2014-2023 of World Health Organization. The WHO has also announced the setting up of the Global Center for Traditional Medicine in India. We welcome this step. You would be happy to know that already students from various countries are coming to India to study about Ayurveda and traditional medicines. This is the ideal time to think about worldwide wellness. Perhaps a global summit could be organized on this theme. We should also think about Ayurveda and Ahar in the time to come. Food items relating to Ayurveda and food items that further good health. Many of you would be aware that a few days ago, the United Nations declared 2023 to be the International Year of Millets. Let us spread awareness on the benefits of millets. Friends, let me conclude with a quotation of Mahatma Gandhi. I quote, I think highly of Ayurveda. It is one of the ancient sciences of India which ensures the health of the millions in her thousands of villages. I advise every citizen to live life accordance with the principles of Ayurveda. The pharmacy, the dispensary, and the Vaidra all have my blessings that they may be enabled to render the best possible service to Ayurveda. Unquote. Mahatma Gandhi said this more than 100 years ago. But his sentiment is relatable even now. Let us keep building on our achievements in Ayurveda. Let Ayurveda be a driving force which brings the world to our land. May it also create prosperity for our youth. I wish this conference all success. My best wishes to all participants. Thank you. Thank you very much.
Pranams at the largest personality that we have seen leading India and for his kind words. It is a great inspiration for all of us who are the soldiers of taking this mission further. With these few words, we cannot thank enough our beloved Prime Minister for his kind leadership. And the program comes to an end of today's very cherishing day. And the vote of thanks will be delivered by none other than a great person who have been talking about integration, who is a testimony of integration, who is a modern medical practitioner and a pediatrician by specialty, who has adorned and adapted a lot of things from Indian traditions, and one among them is Ayurveda. And he is a talented leader and a great worker, and Dr. C. Suresh Kumar, the General Secretary of CISA and the Chief Coordinator of GAF, who inspired thousands of youngsters to take part in this program. I invite him to deliver the vote of thanks for this monumental.
Namaskar. Most respected Prime Minister Sri Narendra Modi ji and esteemed dignitaries on this virtual dais. First, let me express my huge gratitude and pride to note that today our nation is emerging in high pace, transforming challenges into opportunities and setting its own glorious example for the world. If COVID time to be remembered by generations as a heavy blow to the normal life of the world, here our country is etching in gold, unique and emulative tales of success over epidemic. If not to elaborate, this global Ayurveda festival is a glittering addition to such Indian legacy. The thriving and ever-expanding domain of Ayurveda itself is a shining testimonial for the world to see about India's own caring and curing system that all have been surviving the test of time for over thousands of years. Most respected dignitaries, I am sure that similar to the three previous episodes of GAF, the fourth one opening today is also going to hold high the science and merits of Ayurveda with all convincing propositions. With the very fact that our Honorable Prime Minister has inaugurated the third and the fourth Global Ayurveda Festival is a splendid sign of the country's unblemished commitment for the progress of Ayurveda. On behalf of the 4th Global Ayurveda Festival, I record earnest gratitude to the respected Prime Minister Sri Narendra Modi ji. Without the brotherly affection and consideration, unflagging support and keen interest provided by Honorable Minister for External Affairs, Sri V. Muralidharan, the GAF 2021 would not have been a vibrant virtual reality for the world to witness as we do it today. Please let me express my profound gratitude to Honorable Minister Sri V. Muralidharan. Our sincere and most gratitude to Honorable Minister of State for Ayush, Sri Kiran Rijiju, for endorsing this global Ayurveda conclave festival with his precious words. The organizing committee of Global Ayurveda Festival expresses its utmost thanks to Honorable Secretary, Ministry of Ayush, Sri Vaidya Rajesh Kotajaji, for the huge support he has been extending to our mission since beginning. Our sincere and most thanks also goes to Mr. Uday Shankar, the President FICCI, for tremendous association his organization has been extending for the realization of Global Ayurveda Festival 2021. We thank Secretary of FICCI and Joint Managing Director, Apollo Hospital Enterprises Limited, Dr. Sangeeta Reddy, for the boundless support of her organization has been providing for this event. Please let me take this opportunity also to thank our guide and mentor, the President of the Principal Organization behind GAF, the Center for Innovation in Science and Social Action, and Ayurveda Acharya of no comparison, Dr. G.G. Gangadharan, for being our moral strength and vision. I thank all sponsors, the organizing committee members, online and offline supporters who have toiled and moiled selflessly for the realizing this glorious day. Dear delegates, academicians, and the Ayurveda Acharyas assembling from far-fetching, reaching ends of the world, our sincere and most thanks to all of them, of all of you, for adding bigger and life to this event. Thank you so much. Have a great day ahead. Thank you. Jai Hind. Namaskar.
Thank you. With the grace of God and blessings of the elders, let us proclaim that today's plenary session comes to an end. Thank you. Namaskar.